Hi, my name is Todd Vaughn. I'm a physical therapist. I've been practicing for 30 years. I'm a board-certified orthopedic specialist and a certified manual therapist. We see a variety of patients ranging from spine to shoulder to ankle. So we just treat a variety of conditions related to the musculoskeletal system. We also treat vestibular issues and neurological conditions, definitely a lot of spinal conditions. We see a big variety of patients as far as age groups. Ranging from kids that are toddlers to older adults, and certainly folks that are in their later years of life. In the state of Illinois, we do have direct access, so you don't need a physician referral, although a lot of physicians have close relationships with their patients and refer them to our facility. But you can choose in the state of Illinois to go wherever you like to go as far as your physical therapy. You just need to call and set up a time. Mobility is probably the big issue. As we get older, things just tend to stiffen. We don't realize that our bodies just take the path of least resistance, so we start to lose mobility, and that leads to flexibility issues and faulty movement patterns, and that tends to lead to dysfunction over time that accumulates, and before you know it, you start to have pain in certain areas, and it's just a matter of now it's above the threshold of your pain, and now you're aware of it, but there's probably been something that's been going on for a while. We definitely try to address the long-term problems and come up with solutions in terms of how to manage those, once they're finished here. The home program is always a big component of what they're getting, and it's always a relationship where we're helping them work through a situation where they're having some dysfunction, but without the patient's direct involvement in a home exercise program, and really trying to break down the movement patterns and the things through their daily life that's causing some of these issues. It definitely is a situation that requires both myself and the patient to kind of work together to kind of figure out those issues that need to be addressed. Movement is medicine. I mean, our bodies respond to movement, and whenever we immobilize things or we don't move properly, it does create a cascading effect on our body. And proper mobility, neuromuscular control, stability, muscle performance, and progressing into functional activity, that's what we're always kind of assessing and trying to manage the patient so they can perform at their optimum.